We're going to go live. We're so excited to have you here. We are at the Wayside Women's Services ECHO, and we're going to be hearing from No Wrong Door today, and some people who work there, not just the entity. I want to start by saying that if you join us while the meeting's going, and we'll let people introduce themselves at a natural breaking point. But I'd like to start with introductions. And let's start with the people in this room. I'm here, Rebecca Buller, Education and Prevention Specialist at Wayside. And I'm going to introduce my colleagues first. I have Sherry Fisher here, and she's our Community Coalition Coordinator, the 3 C's. And we have Lucia Diaz-French, who is our ECHO Coordinator and Education Prevention Coordinator. Currently, we have James here, who is our IT Manager and has been overseeing us learning to do the technology on our own, because James is going to a new opportunity for next week. And then we have our guest speakers with us, Amanda Koonjbeharry and Dale McCauley. Let's go to Jessie and have you introduce yourself, please.
Hi, Jessie Everts, also from Wayside, just from our family treatment location today.
And Caitlin, it doesn't look like you have video, but could you introduce yourself and unmute? Caitlin? Caitlin, can you? Okay, now we can hear you.
Oh, great. That's a weird pause. So I'm from Fairview Behavioral Health.
Great, Caitlin. And will you be sure that we get your information in our chat box so that we know and make sure we get continuing education information to you?
Sure. I'll give you my name and then the name of the other person who's here with me.
Yes, very important. Thank you.
Thank you.
Who is the person with you?
Oh, hi, I'm Angelina McDowell, social worker.
She's a care coordinator with our IBH clinics.
Thank you.
Wonderful. Great to have you both. Now, it looks like we have someone on the line, and the number is 612-297-3438. Can you introduce yourself, please?
Hello, can you hear me?
Who are you? Oh.
Hello?
Now we can hear you.
Can you hear me?
Yes.
Okay, hi, I'm Bethany. I'm at the Fond du Lac Human Resources Center in the Metro location.
Wonderful. So glad to have you join us.
Thank you.
And then it looks like, who's the person in the dark black box? Is that a person or is that a...
Hello, good afternoon. My name is Artika Roller, and I'm with Hennepin County's Transformation Team.
I'm going to ask you to repeat that because we couldn't hear you at all, just kind of a muffled... Who is there?
Sure. Hi, my name is Artika Roller, and I'm with Hennepin County's Transformation Team.
Oh, welcome, and we're so glad you're here. Thank you.
Thank you.
All right, so we're going to turn things over to Amanda and Dale, and just let you work through your presentation, and then we'll open it up for questions.
Great. Well, good afternoon, everyone. So nice to be here with you. Thank you for joining us. As Rebecca said, my name is Amanda Koonjbeharry. I am the director of the Hennepin County No Wrong Door Initiative, and we'll walk you through what that all is, what the program is, and some of the initiatives that we have right now. And I'm here with my colleague, Dale.
Oh, hi, I'm Dale McCauley, and I'm a supervisor in Hennepin County. Folks in my unit, I have a couple of case managers in the unit who have a caseload that's exclusive to youth who have either been sexually exploited or trafficked.
Great. So we'll get started. Is this the... I don't know. I think the slides might be out of
Hmm.
order.
I think that's just the ones, we just did it from the drive right there.
Okay. Sorry. Let's do previous. Some of yours aren't on it for some reason. Which one did you open on the drive?
If you,
Can I go? No.
yeah, let's see.
Okay.
Pull out of this one.
I can stop share.
And then,
Exit full screen. Go to the folder.
Okay, it has today's date, the one right above it, the presentation
This
echo.
one?
Yeah,
Okay.
that one. Yeah.
there we go.
Show that one out.
Perfect. Yeah.
You gotta zoom and then share first.
Share. And then it was this one?
Yes.
Yes.
Yep.
That's start slide.
It's the first time, and our people know that I've mentioned that James is leaving.
I don't-
It's our first time being in charge of our own technology. so
No
we'll see
worries.
this out.
Yeah.
Thank you.
Well, thank you to everyone for being patient too. Okay, this looks right.
Good.
So training objectives for today, we're going to define what we mean when we say commercial sexual exploitation and sex trafficking of children and youth. We'll go through some of the risk factors and red flags, and then we'll talk about the statewide system and response and the countywide response model that we have. And so just to kind of frame it, I like this definition from Minnesota Department of Health. It talks about what minor commercial sexual exploitation is. So you can read that. They raised the definition to the age 24. There was new legislation passed in 2016, I want to say, that increased the services and shelter response up to age 24. So folks 18 to 24 can access those services. However, the criminalization piece is still not for adults. So safe harbor in terms of the criminalization, it's decriminalized with the youth. So do you want to add anything?
No, it's good.
Okay. And then I just put this on here too. So when we talk about sexual exploitation, that can include so many different things. It can include survival sex we talk about, and Dale can talk a lot more about what him and his staff see. But when we talk about sex trafficking, we're really talking about that third party who's benefiting from the exploitation that's happening.
Okay, this is actually pretty self-explanatory. There's a couple things that I'd like to say, just that while these are it's a little different than the slide I was looking at earlier, I apologize. So while these are risk factors, they're not always things that can be uncovered. Many of the youth that we see are pretty guarded, and while they may be running away, but they may continue to be going to school while they're gone. So it's not, there's not an issue here that's specific that says these are youth who are being exploited. But what else can I say there, Amanda?
Is there anything that your staff see in particular more of as far as some of the vulnerabilities?
Chemical use is pervasive. I think we see a lot of youth who are who take a stance of fight or flight. There's a lot of high aggression is an issue with a lot of the youth that we see. I think that's about all. Yeah. I think this is again pretty apparent. The areas that I'd like to underscore here, where surprisingly we see a lot of youth who are referred to us who congregate at libraries. We had a fairly major operation that was at the Brooklyn Center bus shelter. Wherever youth are congregating, they are. If there's someone who is in the life, there is an opportunity for enticing and recruiting others. So what's not on here are group homes or youth shelters or residential treatment programs. Those are also areas that unfortunately are ripe for recruitment by peers. And this again is what I was just talking about, where we can see some of the concerns. Again, the bus shelters, rest areas, hotels. I think there's been good training that's gone on to hotel employees to help them recognize what situations are going on. The youth that we see kind of run the whole spectrum of those youth who are maybe doing some sexting or otherwise involved online in chat rooms, or being recruited online to send pictures, send photos, get involved in what used to be Backpage, but now it's turned into other areas of recruitment online. To those youth who are in hotels, working in hotels, come to us after having been recovered from hotels by law enforcement.
In the online piece, do you mind talking a little bit about that? Because a lot of it.
Yeah, a lot of what takes place is online. So any of your old notions of youth who are working on the streets, that's just not who we're seeing. We're seeing more youth who have been caught up in online activities where they're being solicited by males. They are being advertised, for lack of a better term, online for services. And some of the youth are have people who are actually putting them online, taking the photos and putting them online, and that includes the advertising, or just through Facebook, where they're putting pictures online. So it's a major concern, and as much as I could say, it's a gateway for a lot of the youth who we see. And just unfortunately, coincidentally, last week, we had referrals for 2 9-year-olds who were being solicited to send photos to males. And, parents of a 9-year-old aren't even aware that that's something that their youth could be, in this case, child, would be involved in. So it's really pervasive how much online activity goes on. Again, I'll say that while these are some of the red flags, it's not always that we see this with the youth who we are providing services to. Yeah, I think you hear a lot about tattoos and branding. We've been doing this for 5 or 6 years now, and I think we've only seen 2 youth who actually have marks that would be from a trafficker of a branding with dollar signs or with their name on them, tattooed on the youth. So while these are things to be aware of, they're not always the things that are going to jump out at you. So it's maybe this whole combination that you're looking at of a symptom of what might be going on. I'd also add withdrawal, resistant to any efforts to ask what's going on. Those kinds of issues also are, it's not like a youth is going to jump right in and say, yes, I'm being trafficked or I'm being exploited. It's what we've found is our work with youth is really dependent on developing those relationships. So one of the workers in my unit had a young woman that she was working with, and it wasn't until after a year of establishing that relationship and building that trust that the youth finally spoke with her about what was going on. So it's not an easy relationship build. Again, we do see, and I'll go right to that final bullet of the not necessarily multiple phones, but youth who show up at home with a cell phone that they know, that the parents know that they're not paying for, somebody's paying for that phone. And I think that's probably the number one indicator that we see, in addition to the unexplained money, clothes, makeup, hair. Those are definitely things that we see among some of the youth that we work with. I mentioned before missing school, but a lot of the youth are still attending school. It is a sense of normalcy for a lot of youth, even if they are running away or can be deemed as homeless youth. I'd add here not just homelessness, but staying with unknown friends, that names that parents don't recognize or that they can't provide a last name. Again, I said the aggressive behavior. There are times when we look at placing children outside of their home, and we run into difficulties when we're looking at some form of an out-of-home placement. As much as we try to work with youth in their families' homes, when we are looking at out-of-home placement, one of the biggest barriers to doing that are the aggressive tendencies of many of the youth that we work with. Excuse me. I don't know if you can see these tiny numbers here, but it takes you back to 2012 when we first identified this population and started documenting the number of referrals that were coming in. In Hennepin County, reports come typically through child protection. Child protection up until 2017, ruled out all of these reports. So a report would be made, and because the parent wasn't the perpetrator, those cases were ruled out, and then those youth were sent on to myself and a representative from the county attorney's office to review what was going on and to ensure that law enforcement was receiving a cross report on all of those cases for the possibility of law enforcement investigation. So the numbers stayed fairly low, as you'll see, until 2015. In 2015, DHS, Department of Human Services, made sexual trafficking or exploitation a mandated report. So you'll see the spike in numbers that went up at that point. And that is carried through the newer number. 2018 numbers are roughly the same as they were in 2017. It's leveled off. It's actually a little bit lower in 2018. And my sense of the lowered number is that the mandated reporters now have a better understanding and awareness of what constitutes a report. So we were among those high numbers also receiving reports of sexual abuse, sexual assault, youth that didn't fit our definition of a youth who's being exploited or trafficked. So people are now, I think, more aware of that, and the numbers have leveled off a little bit. I'll also add what's not on here, just a little information about the reports that are coming in. About 10% of the reports that receive are male, and about 10% are Native American. And I call out both of those figures just because I believe that they are both low. I think that those are both underreported, underserved population. And the reports that we receive from the Native community is that there are far more youth who are involved in being exploited. We're just not getting those reports.
All right. So Minnesota's response, I'll kind of go into some of the safe harbor stuff. And Dale, please jump in at any time. So safe harbor law was passed in 2011, and it kind of shows some of the key changes that did. Dale talked about some of the child protection responses too, and adding that into the child protection code so that they could respond. And then the penalties that went up against folks who purchase and are trafficking individuals. And then with this, then came the development of the no wrong door model. And not Hennepin County's no wrong door model, but the statewide one, and I'll talk a little bit about that too. But a couple of additional changes that have happened in 2014. And then one to highlight, again, I mentioned this, that the age for shelter and services was brought up to 24 in 2016. And then this was the mandate that Dale just talked about that happened in 2017.
A couple of things within here is that back in 2014, as part of the decriminalization, a statute was added to child protection legislation that we now have the ability to bring cases into court if we deem that might be an assist to the family. So we have done that on a few cases using the statute for the sexual exploitation. It's not something that we tend to do. It's just another tool that we can. There are some youth who do have a respect for the court and that they will comply with some recommendations for services to them through court order. Generally, we find that's not really effective and would much prefer working with youth and families on a voluntary basis. The 2017 represents a switch in child protection investigations that up until that date, child protection, as I mentioned earlier, ruled out all of these reports, and they were considered law enforcement investigations only. In 2017, the mandate became that child protection, if an offender was named, could be part of a child protection investigation. So while they still cross-report all of these referrals to law enforcement, there are some times when child protection is doing the investigation if law enforcement declines. So it represents a major shift because child protection has always been family only, and now even with non-family members, they are doing investigations.
And then, as I mentioned, so this is the statewide no wrong door model. This graphic is a little old, but I think it's helpful to explain what that response did. So the legislature, they allocated funding, and it kind of shows how the community response was. So Department of Health has a statewide director who really oversees kind of the operation and implementation of this plan on a statewide level. One key thing were the regional navigators, and I'll show you a map of kind of where they're located, but they represent the different regions. So we have one in the West Metro, and we work with that person. They're usually placed at different nonprofit sites or community-based organizations, and we can call them if we're looking for shelter beds or other resources within that area. And then they work together with their local region. And then the other thing, the specialized housing is a really big piece of it too. So we'll talk about some of those housing options later in the slide. Anything you want to add?
No.
So here is the map of the regional navigator system. So you'll see it's kind of small, but there are several different ones throughout the state of Minnesota. And if you want contact information of any of these folks, you can find it on Department of Health's website, or we can send it out to you. And Hennepin County's response. So I want to say in 2013-ish, one of our previous county commissioners, Gail Dorfman, had wanted Hennepin County to really take a lead on this issue. So she and a bunch of other folks at Hennepin County came together to develop Hennepin County's No Wrong Door initiative. So it's the same name that we use as the statewide one, but it is specific to Hennepin County. And our county board approved this plan in 2014. So the plan itself is consistent of 6 different goals, and you'll see them all listed here. I'll go through each one, and then I'll talk a little bit about what we've done to date and where we're going with the work. So when we talk about prevention, it's pretty self-explanatory. We're looking at what are the root causes and trying to do this in terms of early intervention services. And I will say these are things that we're working on constantly. So I'd say right now we're trying to kind of build some of those relationships with schools and figure out ways to do that early intervention education. So trainings like this are really helpful, but also trying to reach kids when they're young too. And then with this, we're able to also support legislation or policy provisions that are put in place that do support youth who've been sexually exploited. Training, education, and public awareness. So this is us really figuring out how do we do like what we're doing right now, community education, and also how do we educate our staff at Hennepin County. So I'll talk more about this, but we have developed an e-learning for Hennepin County staff, and it's really kind of a baseline tool that we're going to use to educate folks on the issue, sensitize them to the topic, and inform them on how they respond if they see something.
I think the first major training initiative that came after the adopting of this was with law enforcement on a statewide basis. So Department of Health allocated money to ensure that all law enforcement throughout the state received this information.
Identification and assessment. So right now we have a work group that Dale and I are on, and other folks at Hennepin County. And we're really trying to figure out how do we identify youth that come into our system. We have so many different access points, and so really trying to figure out what do people ask, what questions are they asking, what screening tools are they using, and how are they asking those questions so that we can then identify youth and provide resources in an appropriate and timely manner. Service delivery. So we contract out with a couple of providers. We have 3 contracts right now, specifically within the No Wrong Door framework. And one is with the YMCA. So they provide a one-to-one service to our youth and a group program called Girl Circle Heart. So it's more of an educational model. They talk about different things like healthy relationships, boundaries, looking at empowerment of the youth. And then we have another program called Runaway Intervention Program, and that is through Midwest Children's Resource Center. And it's more of a public health. I think public health nurses are working with youth and providing that support and case management. And then we have an equine therapy service through Hold Your Horses. So young people are working with horses and also receiving therapy as well in a group and individual setting. And then shelter, supportive housing, and residential treatment. With this, so we do have a couple of contracts. We work with Brittany's Place over in St. Paul. And we also have a contract with the Link Passageways, their shelter. So, and then I know your staff refer youth to different shelters as well. Like I have a couple of them. Forest Ridge, it sounds like.
Right, Forest Ridge in Iowa is a specific residential program that works with this population. Heartland Girls Ranch out in Benson also has a specifically designed program that we've used for a couple of, it's again, female-only program. There is also a shelter when there's a need for a youth to really be removed from the metro area generally for safety purposes. In Duluth Lifehouse is another program.
And then prosecution and law enforcement. So again, we're looking at how do we identify folks who are purchasing sex and traffickers? How do we hold people accountable? And really looking at that system of working up a case and then taking the next step to prosecution. And I'll talk more about how we've kind of built up our team in Hennepin County. I like to show this because it's helpful. So in terms of the work that I do with the initiative, I have an advisory committee that kind of helps to guide that. And we have representation from each of these different areas. So again, I like to show it because we are working pretty comprehensively with most folks in most areas in Hennepin County. And then a couple of key deliverables that we've had. So this position that I have started in August of 2014. And then in 2017, we were able to hire 2 social workers in Dale's unit. So he's supervising them and referenced them a couple of times. When I first started, I went out to different law enforcement agencies, different police departments, and really heard the need to have a dedicated prosecutor who was working on these cases. And there were folks in the county attorney's office already doing this work, but having one person that they could call to find out information was something that they really thought would be helpful. So we went to our board and did a request for funding, and we were successfully able to get funding for that prosecutor. He is still there, and it's embedded within their budget, so that position is sustainable as far as we know. And then same thing with the sheriff's office. We were able to get funding for an investigator there, an analyst, and then the sheriff, the previous sheriff had dedicated a detective, and they have somebody who supervises that team. So they're all working together to work up the case. And then most recently, the county attorney's office, they got grant money, and they have a criminal analyst who is working with them to this day. A couple of other things. I won't go through all of these, but so I talked about the e-learning. That took over a year to develop. I want to say almost 2 years potentially. And we are rolling it out now. With reports, we've had a couple that we partnered with. The first one when I first came on was Voices for Safe Harbor. And that was a partnership between several other agencies in the state. And it really looked at the experiences of folks who've been in the life and other individuals who may work with them, or family members and friends, and really just kind of highlighted what they're experiencing with our systems, and how we as systems professionals can improve how we serve the community. And then Super Bowl 52, so we helped to co-lead that initiative, and I have information about it that I could share at a later date, but it was a huge endeavor and a lot of people were involved. But I highlight that because it really took a lot of energy from many partners in the state of Minnesota, and the execution of our response was pretty seamless during that time. And then resolutions and communication, we're working internally in the county. We will do a resolution with our entire county board during January and February to kind of call out National Human Trafficking Awareness Month. And again, it's just to bring that awareness to folks that this is happening. And then community trainings, I know we've done a bunch. I think I've done over 50. I counted it in the past like 2.5 years. So it's quite a bit. And Dale, I'm sure you've done many.
Mostly internally.
Yeah. And then, so current activities and focus and where we're going, the county has really committed itself to looking at reducing disparities. And they have, I want to say, seven different areas that they're looking at. And I don't remember all of them, but we look at healthcare, transportation, justice, housing, employment, and one other that I'm blanking on. And with that, so education is one, and I'm working with that group just because of the nature of this work too, and wanting to ensure that we reduce disparities in educational access, and as a way to prevent these issues as well. Mm-hmm. Assessments and screening tools, I talked about this, that we have a work group right now that's looking at different areas within Hennepin County. So we recently brought in our eligibility and work supports area to hear more about, are there opportunities and touch points where, you know, that the staff that work in that area may encounter youth who've been exploited. And I think we are looking at other avenues now of where those touch points may be. We're also focusing on the juvenile detention center and going to be developing some questions that staff there can ask young people. Research, so we've contracted with the University of Minnesota, Dr. Lauren Martin's team, and they're doing a pretty extensive research project right now in Hennepin County, really trying to talk to youth and talk to staff and understand what's kind of our system in Hennepin County, how do youth come into that, where do they kind of navigate throughout, what services are they accessing during that time, and then we also want to understand what youth's perspective is with our services and with their interaction with Hennepin County. And the intended goal is to then use that information to, again, improve how we do this work and how we serve young people. Policy, we were looking at ways to reduce barriers to expungements for adults. So the work that we do is not just with youth, it does kind of expand into the adult world as well. And so we are working with a group of graduate students right now, and they're looking at the current system of expungements and trying to understand how does that system work? Where are the potential barriers that people are running into, and where are there opportunities for change? And we'll use that information to either create legislative or procedural changes in 2020. And then Super Bowl research, I'm working with another group of graduate students right now, and we're trying to understand how impactful were the trainings that we did during that time. We did a ton of public awareness and trainings and campaigns. And so really wanting to try to reach back out to folks who got those trainings, received them, and trying to understand, did they retain that information? Did they share it with other people? And what was that process like? And then Final Four, we're not doing planning like we did during Super Bowl, but we are looking at ways to still do some of the work that we did. So having resources and maybe folks who are doing outreach. So trying to figure out how we can do that. And then protocol development. This is work that happened a long time ago. I don't know if you were involved in it, Dale. Okay. So MNCASA, the Minnesota Coalition Against Sexual Assault, they had brought a group of folks together within the state to come up with protocols. So let's say you are a mental health professional, and they came up with these protocols to say this is kind of best practice or how you should be interacting with the population. And they recently have granted out funds to different areas in Minnesota. So Hennepin County is one area, and the link is the organization running the project. And so now we're looking at, okay, within Hennepin County, how do we do this work? So if I am a healthcare provider, this is how we do the work, and this is how we should do the work in this region. So really developing those protocols specific to the area that you're in. So it's an active group right now, and those protocols should be finalized, let's say this summer sometime. So those are some of the key areas of work that we have right now in terms of No Wrong Door. I don't know if you wanted to say this or me.
Yeah, I think I mentioned before that if it is a mandated report and that we do, I think the law allows for a call to either child protection or to law enforcement. I don't want to malign anybody in law enforcement, but I'm sure that if a call is made to our child protection, that there's a guarantee it's going to be cross-reported to the appropriate law enforcement agencies. And as Amanda mentioned, we work pretty closely with Minneapolis. They have dedicated lieutenants who are working in this area. And the Hennepin County Sheriff's Office also has a designee so that we can make the reports directly to that person. And some of the suburban districts want to be involved and do their own investigations, so they can coordinate that between the Sheriff's Department and those jurisdictions. But I guess a strong preference is that the report come in through our child protection. As I mentioned before, all of those reports come to myself and to a colleague in the county attorney's office, and child protection reports their cross-reporting to the crimes against children, for instance, in Minneapolis, and we make sure that it gets to the sex crimes unit as well in terms of whether or not there's going to be follow-up investigation.
So that's all we have. Thank you.
Mm-hmm. Wonderful. Well, I have questions, and we want to open it up to others. Let's move from the PowerPoint back to so we can see each other, and then deal with the questions with a little more. Let me just start with my question while we get this going, and before, oh, there we go. Which one is most important? Well, here, you had said something about, toward the end there, about the age group and working with youth and mandated reporting. Does that include the 18 to 24-year-old, or is it mandated reporting only under 18?
Unfortunately, that's a next step for us because we just have the 2 dedicated positions, and right now both of them have caseloads that are roughly 20 youth. So to be able to expand to beyond 18, we just don't have the capacity right now. So I think it's something that we need to do some further exploration.
Okay. And the mandated piece is only to 18, right? Yeah.
Okay. Right. I took the first one. Does anyone else have a question? just kind of wave and unmute yourself.
Hi, I wondered, I know you don't want to go too deep into what all went into the Super Bowl, but was the Super Bowl organization interested in the efforts? Do you think that, I know that the Super Bowl itself is a really big sex trafficking event. Are they, as an organization, open to, are they wanting to know what comes out of the research? Are they wanting to make future Super Bowls more safe in this way?
I'll say a couple of things. So, because you asked a couple of good questions there. The first thing I'll say, so we wanted to verify whether or not it was the largest event, right? That myth is kind of out there. So just to touch on that point, Women's Foundation contracted with Dr. Lauren Martin, so UROC, to do a study to find out, is it the largest event where sex trafficking occurs? And they did a study to look at the number of ads that are placed online. And they found that there is a slight uptick in ads that are placed online during that time, because you have an influx of people coming into your city, but it's not any more significant than any other large event. So I just say that to clarify to folks too. And I'd be happy to send out that research because it is really informational. And so we made sure that we said that during that time. And then the Super Bowl, so there was the host committee who really oversees the operations on the ground in that city and does all the planning work up until that point, and works with the NFL to do that. So they were really supportive of this work, the host committee themselves. They were good partners in this and tried to support as much as they could. We had to be very careful of using any NFL branding though. I'll say this, like any sports organization, I would assume, tying your event and your brand and your name to any issue, whether it's human trafficking, domestic violence, sexual assault, will potentially ruin their reputation, right? So we had to be really careful because they were supportive, but more in a quiet way, if that makes sense. And so we as a committee had to be very mindful of that as we were doing this work and talking about this event. I hope that answered your question.
Am I right that much of the work that was done here became a model for Atlanta this year?
Yeah, thank you for bringing that up. So I will say that's the great thing. Even though the NFL maybe they're not interested in the reports and all of what we did have the anti-trafficking and host committees from Atlanta call us, and we sent them our plan, and then Miami as well. So we had a conversation with them recently. I wasn't able to be on the call, but we've shared our plan with those folks as well and are happy to share it to anybody, to be honest. So, and it's great that they're calling us. Yeah.
Yeah. Any other questions? Just unmute yourself and jump in.
I have a couple questions, please. I think just to start, like a really basic question, I think a lot of people tend to think of sex trafficking to do with like geographical borders. And so in the work that you guys doing, just like a very simplistic definition is just a trafficker and then a victim survivor involved. And that is how you are defining it. Like, I think a lot of people think that sex trafficking has to do with crossing state borders versus being within one region or without those like city lines having to do with anything.
Okay, gotcha. Most of the youth that we have served over time have been locally only. There have been instances where youth are being trafficked over state lines, and then either FBI or Homeland Security have gotten involved. But that's the exception. Most of the youth are here, and the traffickers are also here.
Okay.
Can I jump in? We have, is there someone from Homeland Security on the call with us? Well, she may not want to say, but I think she is. But I thought she could speak to that cross state lines piece, but we'll keep going. Next question.
So another question is, do you guys know of other states that have this kind of legislation or groundwork that you guys are doing?
We modeled, I think the state modeled some of its decisions on other states who had already been down this road. So Connecticut was an early adopter. New York, I think, was, can you think of other states?
I want to say most states have a safe harbor law now, I would say. And
No,
can't
but I
the
think
ones.
when we started, though, we brought in
Yeah.
some of the folks who are doing this work from the state of Connecticut. And they kindly came here at no cost other than paying for their flight and their accommodations, but they didn't charge anything because they believed in what they were doing and that they had made some successful outreach. Connecticut is about the size of Hennepin County, so they can do things, and they do things at a state level, not at a county level. So they had more of a working relationship with all of their hospitals throughout the state. But they were an early adopter of making changes in the law and decriminalization.
I have another question, unless I wondered, because of the work that Wayside does, and I know some of the people on the call work with adults, and so I'm particularly interested in that 18 to 24-year-old population. So how might service providers or treatment providers, how do you see us accessing or assisting or interacting with No Wrong Door, whether it's Hennepin County or anywhere else? Because that's who's going to be in our treatment facilities in most cases.
Well, I think, did Lorena come yet, or will she be?
Don't know. No.
Okay. Well, I would say
But
bringing.
we'll ask her.
Yeah, I would say bringing in. Okay. An organization, and there are many different organizations, but I know we were on an email together. That's why I bring her up. To come and talk about how they're serving adults might be really helpful from that service provider perspective. And then the regional navigator is a resource. So I would say that person too, maybe bringing them in or having them, connecting with them in some way, because they are going to be serving young people up to age 24 as well. And then if you, encounter someone, they might be a really good resource.
Unfortunately, since our work is with youth, there is kind of a strong barrier at age 18. So even for those youth that we work with where housing is an issue, we have trouble looking at anything beyond a transitional programming. And even that, we still run into that problem with they can't get services until they're 18. And then at age 18, we unfortunately have to end our involvement. So some of the programs we work with, like the Link, like Family Partnership, they cross those boundaries. So they work with the young adults.
Good. I'm curious about do you know whether there's any legislation in the works to, you had said to raise that non-criminalization to 24?
So the Safe Harbor for All research was put out recently and shared with the legislature. And at this point, I know there are conversations about it. I don't believe there is no bill out there yet looking at that, but that's going to be a multi-year type of campaign. So there are folks talking about it though, for sure. And taking those recommendations and putting them into action. So.
How do you guys so I know you talked about it being hard, like the Super Bowl, kind of like the myth around that. How do you guys, and you talked about having to build those relationships with individuals. So how do you kind of get polling data that you feel like is accurate in terms of like finding the locations? And we know those locations are high trafficking locations. And I mean, how do you even from square one start with getting that information with the level of secrecy around it all?
Yeah, we get, sometimes reports come from strange ways that we find out that there's a house that's being used. Sometimes it's coming from our colleagues in child protection who have youth on their caseloads that are repeatedly going to those locations, and then those reports come our way and we can get law enforcement involved. So some of that, like I said, we have some very active parents that we're working with who, when their child goes on run, they're looking for them, and libraries unfortunately, the downtown library is kind of a magnet. And I mentioned the bus terminal in Brooklyn Center. We have parents who go there and kind of stake out, even though there's some danger involved in doing that. They're out there looking for their child.
I'd also say to check out the mapping the market and mapping the demand research. I thought I had a slide in there about it, but I don't know where it went. But those are really good because that team, they were able to talk to folks who've been in the life to kind of figure out with that graphic that we had where things are happening too. So
I'm hoping that you'll share your slides with us so that we can send them out to the participants. And then if you maybe want to add a couple of these resources that you've mentioned to the last slide, then we'll make sure everyone gets the information. we're going to wrap up here very shortly because we're nearing our 1 o'clock time. Is there anyone else on the ECHO with us who wants to ask a question quickly? You have to unmute or wave. Okay, well then I'm going to continue with our wrap up. You can always write something in the chat box if you don't want to talk. And if we want, we will have contact information for both Amanda and Dale so that if you think of something later, you can ask it then. Our next meeting is it's March. I got to get the right month. March 21st. And the topic is, the mother-baby program. And they're going to, we'll have Tasa, who will be here with us, and we'll learn a little bit more about the Hennepin Healthcare mother-baby program. In the near future, we also have the mobile SUD S team, substance use disorder. What does the S stand for?
It's the SUDS, they're multiple crisis
multiple teams. Okay, so it's a little S.
Mm-hmm.
So, and then also after that, a new app that's been developed and is being used called Recovery. So there's a lot of really good things coming up. I also want to highlight, because I got a number of questions, and this is in direct response to some of our ECHO participants, that we learn a little bit more about the legal system and how we work together in treatment and supportive services. So Law Help Min is a website, and we'll learn more about how to access that and use that tool with our clients and patients. And also a housing guide has been put together for applicants who have come from or have experienced some kind of criminal justice interaction. So if they have felonies or a criminal record, it's kind of a guide to how to navigate getting housing. So we've got lots of good things coming up, and we look forward. I will not be here next time, but Lucia and Jesse will lead us. And as always, if you're interested, we will be sending out the evaluation form. It's a new form. Is that ready? A new form. It's in Constant Contact. It's really easy to fill out. And be sure to indicate whether or not you'd like confirmation of your attendance for continuing education purposes. We have been approved for all social workers, LADCs, LPCs, and LPCCs, and we meet the requirements for a number of the other professions like nurses and marriage and family therapists through individual study. So please fill out that form, and when you do, we'll send you your confirmation of attendance for your CE file. Thank you so much, Amanda and Dale, for being with us, and we're going to go ahead and wrap it up. Have a wonderful day.
Thank you.
Thank you.